Hi, it's me, Caloris. I'm going to be inserting a nasogastric tube. So I'm going to provide privacy. I'm introducing myself to my patient. So hi, it's me, Caloris. I have an order and I've checked the orders and compared it to put a nasogastric tube. Um, could you tell me your name and date of birth? Okay, do you have any allergies? Okay, because it says you don't, okay. You had any nosebleeds or anything? Okay, so we're gonna go ahead and I'm gonna get started. So I'm gonna perform hand hygiene. And what I'm doing is I'm gonna check the patient's nares, making sure that, there is no obstruction or any tight to her nares. Okay, I'm gonna use my tongue blade, and then I'm going to check her gag reflexes, and I'm going to make sure that that's all good. Okay, I am going to put her in a high Fowler's position. If they can't do a high Fowler's, it says that you can put them in a 45-degree angle. Also, after I put her into the high Fowler, I'm going to go ahead and I'm going to measure the tube length. So I'm going to go ahead and open. I'm going to sanitize my hands again just to be on the safe side. Let's get that out of the way. Okay, so we're going to open this up so you can see me. So we're going to open this up. Okay, I'm going to get all of this ready. Okay, so what you're doing is we're measuring from the tip of the nose to the earlobe, and then the earlobe to the xiphoid process is what we're going to do. And then I've got my tape prepared here so that, we got the tape ready. So, okay, I'm going to go ahead and I'm going to have this, put it in my lubricant, the tip of it in the lubricant. Okay, I am going to, I'm going to wash my hands again because that's just something I do. I want to apply my clean gloves. And so let's get clean gloves. And like I said, I have already, I've got this in the lubricant. Okay, my patient, she has, let's see, she's got her towel across her already. While that's there, I'm handing her water with a straw in it so that she can sip it. I would also, I can give her an emesis basin if needed and some tissues. And so then I'm gonna go ahead and get started. So, got it in the lubricant here. And what I'm doing, I'm gonna insert the tube following the nasal passage. And what you can rotate it to help get it through the nasal pharynx. Okay, but once we got it there, so then I'm gonna tell her to flex her chin to her chest. I'm gonna also tell her to sip on the water. And then while she's sipping or swallowing, I'm gonna go ahead and advance it. And I'm gonna continue to advance it, until we get it to the point of where the tape is. Okay, so once we're there where the tape is, I'm gonna go ahead. That's when I would like to take my pen and I want to look in, her mouth again and see what I can see. I'm also gonna have this. I would temporarily secure that with tape. Then I would go ahead and look at her mouth, make sure where that is. I would also personally want to listen to her, just to to make sure of what I'm hearing and that want everything to be right. So then from there, after we do all of that to the patient, now I can go ahead and get the content is what I would get the content, what I would do, because I got the syringe already here, I would go ahead and put that into a cup, the content, and here's the cup. And I would be looking, at the color of it. Then I would get my little strips and we would measure it, because you want it to be between 1 and 5 for the, that tells you that it's the acidic, the gastric content, because that's what you're looking for. Okay. So then, once that is done, I would go ahead and, secure it better to her nose. I'd secure it better to her nose. I would go ahead and apply the skin barrier to the nose, and, secure it with the tape. I would secure it to the tube to her gown. I would remove my gloves, and then I'd go ahead and get some hand hygiene. I would also, have the arrange for an order for an x-ray. So my hands, then I would clean my hands again and put on some clean gloves and provide oral hygiene. I would also, once I'm done with all of that, I would put her to a 30-degree angle. I'd put the bed back down to a safe height. She'd have her call bell. I would continue to assess her, and I'd be, the X-ray is coming, and that concludes how I would insert a nasal gastric tube. Thank you.